Part 3, Directional Terms, Body Planes, and Terms Related to Organs. So, anatomical position. Like I was talking about before, the difference between left and right, whether it's your left and right or the patient's left and right, we need to start by talking about anatomical position. Anatomical position is how we set the basis for all of our directional terms in the body. We always assume that a patient is in anatomical position when we just start to describe whether something is above or below certain parts of the body. So in anatomical position, the feet are flat on the floor, the arms are out to the sides with the palms facing forward, and the person is standing upright. So that is our anatomical position. If you recall, the side over here is the right side, because we always refer to the side of the patient, and this is considered the left side because, again, this is the patient's left. Now, prone versus supine, the hands in anatomical position are supposed to be supine. Supine means that they're forward facing. Imagine holding a cup of soup. Your hands would be up and facing forward to hold the cup of soup. So supine, the hands can hold a cup of soup, so they're facing forward. Prone, the hands are facing backwards or down. In anatomical position, again, the hands are going to be supine, but you should know the difference between supine and prone. Some of the directional terms, and again, I'm going to write these off to the side so that if you wanted to print these, you could use them to study for an exam or quiz with. So this first one is pointing toward the front side of the body. This is known as the anterior. Anterior is to the front side of the body. This is pointing to the back, so that's posterior. This is pointing toward the head or up. That's known as superior. And this is pointing down or toward the feet. That's known as inferior. If you have a superior at work, they're above you. So above or toward the head, that would be superior. If somebody feels inferior, they feel below or not as great. So inferior is below or toward the feet. There are other terms for anterior and posterior, like ventral and dorsal, but those terms are usually more for veterinary sciences because animals are usually four-legged and they walk on all fours instead of just walking on two legs. So these are kind of the most common terms that you'd use in a human anatomy and physiology class. Continuing on our list, this row over here we have toward the center of the body. It's known as medial. So medial is toward the midline. Here is toward the outside of the body. That's lateral. For these, we're talking about just the appendages. Appendages are referring to the arms and legs. So when we say proximal, proximal is closer to the point of attachment. Well, where do your arms attach to your body? In the shoulders. So if I say the wrist is blank to the fingers, well, the wrist is closer to the point of attachment than the fingers. So the wrist is proximal to the fingers. This bottom one here is distal. Distal is farther from the point of attachment. So here we can say the fingers are distal to the wrist. The knee is distal to the thigh. Next set of terms, we have toward the surface of the body, That's known as superficial. And then we have deeper inside. That's known as deep. The brain is deep to the skull. The skin is superficial to every organ in the body. The body can be cut into several major planes. So this demonstrates the three major planes of the body, and then we have some derivatives of these planes. So this one right here is showing a separation of left from right. So this completely divides the body in half. This is known as a mid-sagittal plane. So the difference between sagittal and mid-sagittal. Sagittal is any cut in the body that separates left from right. So if we cut right here, that's a sagittal cut. It's separating the left part of the arm from the right side of the body. Or sorry, the right side of the arm from the left side of the body. But a mid-sagittal goes directly down the midline. So this plane right here is demonstrating a mid-sagittal since it's going left from right directly down the midline. Any other cut that divides the body left from right is just called a sagittal plane. This one separates the front of the body from the back of the body. That's known as a frontal plane, which can sometimes be called a coronal plane. Later on in the semester, we're going to be learning about different parts of the body, different organs and their parts, and all of these terms are going to come back. So it's important that you learn all of these up front because these will stay with you for the rest of the semester. So frontal or coronal separates left from right, or sorry, front from back. This one separates top from bottom. And this one is known as the transverse plane. So transverse plane separates top from bottom, superior from inferior. Oblique would be any other cut in the body. So any other plane on an angle that's not described as one of these three is known as an oblique plane. So if we were to cut the body in this direction or this direction, any other angle cut, that would be considered an oblique plane. Now some of the terms that are specific to organs. A lumen. The lumen is the inside of any tube. So if we have any tubular organs like the intestines, the inside of the intestines would be considered the lumen. We have a lumen of a blood vessel. A blood vessel is a tube, so the inside of that would be considered the lumen. Central versus peripheral. Specifically, when we're talking about the nervous system, central is talking about the brain and spinal cord. Peripheral would be talking about the peripheries, or anything that branches out of the brain and spinal cord. Medullary versus cortical. So the medulla of many organs, of many solid organs, it's going to be the inside part. So this is showing the adrenal gland. The adrenal gland has an adrenal medulla. That's the inside portion of a mostly solid organ. The kidney has a medulla. Cortical is talking about the outside surface. So here you can see the adrenal cortex. The outside surface of organs, of mostly solid organs, would be considered cortical. Basal versus apical is really referring to tissues. So the apical surface is the more superficial surface, so this is toward the outside. So if we're talking about the skin, this would be the outermost surface of the skin, while the basal layer is the bottom part, or the deeper part, and that would be closer to the basement membrane, or the underside of the tissue.